The Senior Rehab Project is supported by the Game Changers, a group of motivated rehab clinicians that are crushing mediocrity and advancing care for older adults. You can join this group of people and get access to the private Facebook group, the monthly meetup with article discussions, and have a say in the direction of this movement. Get off the sidelines and get involved. Just go to seniorrehabproject.com/Game Changers. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults. And now your host, my grandson, Dusty Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. Thank you for the download. Today's episode is with my good buddy, Sean Hagey. Some of you all know him as the brains behind Get PT First. He is a PTA, a hilarious individual, awesome guy, and very, very creative as well. But he is currently also working with In Hand Health, and we're going to talk all about that company. But Sean, welcome to the podcast for the second time. You're a repeat offender, correct?
Yeah, I was wondering what took so long. Must have not really, brought the downloads last time.
Well, we were talking about incontinence, so that's not always the sexiest topic. Actually, this is your third appearance. I don't know if you recall the Whataburger episode from CSM.
Ooh,
it's embarrassing, isn't it?
That's forgettable.
So I wanted to have you on, to talk about In Hand Health and the awesome company that you're working for, as they've just been growing a lot and changing a lot. And I don't know if the listeners are aware of this company yet. So I wanted to, introduce them to In Hand, but then also just talk a little bit about some of your experiences, in the different settings that you've worked. So we'll kind of frame this conversation around patient engagement, whether that's through communication or home exercise programming, or different things that we can do to get people to buy in and participate in their therapy. So let's just start off with kind of your background, the quick and dirty of Sean Hagey's career up to this point.
Yeah, I've been a therapist for over 9 years now. It started out in outpatient in Northwest Iowa, rural America by pretty much everyone's standards, and saw a little bit of everything, a lot of geriatrics, of course. Iowa's a direct access state and has been for quite a while. So got to, really get involved in that and have that kind of freedom on a clinical level. And early in my career, even with the first clinic I was at, since, 9 years ago, we're talking about, 2008 and, the beginnings of Facebook and Twitter and all those things. The first clinic I worked at, needed a website and wanted to have social media presence. So, I volunteered to take on that project because, like a lot of therapists, I'm part nerd, geek, and it's like, cool, this would be fun. This is something I'm interested in besides being a therapist. So, I did that, and the next clinic I was at, I did that again. And then I started doing that like as a marketing consultant for other clinics across the U.S., which kind of in a roundabout way led to the start of Get PT First, is kind of like just trying to do on a national level what clinics already try to do at a local level, is, connect with the public, let them know what PTs do and about direct access specifically as well. And, but yeah, the last 3.5 years or so, I've worked in the home health realm. Just, I really love it. It's, fits my personality perfectly of, being able to devote that one-on-one time with patients and have, that kind of an interaction with them and their family and all that. So it's been really fun. And in the last now 1.5 years, I've been the chair of the public relations committee for the home health section as well. So getting involved in the section level and
you won an award. You can mention that.
No, thanks.
Come on now. Was it Distinguished Service Award or something along those lines?
Yeah.
Yeah, man, you've been doing awesome stuff. So anyone that is that follows the home health section and social media and whatnot, Sean's been just getting after it with that and really, helping the section to develop a voice on the interweb. So it's really, I'm really grateful for it. I know lots of other people are too. So I want to jump back to the outpatient clinic. Is this the clinic where you would do your feats of strength out in Iowa?
Yeah. Yep. That is. Yep. Well, that was the second clinic I worked at. Yep.
Okay. Could you give listeners just a summary of the feats of strength? And for everyone listening, I'll be sure to put a link in the show notes if Sean will allow it.
Sure. Why not? So I was working at this clinic, Lamar's Physical Therapy in Lamar's, Iowa. And for people older than me, I'm 35, maybe they'd remember David Letterman's Stupid Human Tricks. They were a little bit more like Stupid Human Tricks than feats of strength because, I'm not a big physically intimidating guy. So there weren't many feats of strength that I could really do, but what they ended up being were like silly, kind of goofy things. Like I used a slide board to slide down the staircase into a pile of pillows at the bottom of the stairs. Roll across like 5 Swiss balls staggered out across the room. There was one where I did some inverted push-ups on a Bosu, upside down Bosu with my feet against the wall, I think, and I jumped over a treatment table, and there's some silly things out there.
The Bosu ball. If listeners, if you're going to watch one video, the Bosu ball. Second to probably between the Bosu ball and the going down the surfing the stairs, those are my two favorite, hands down.
Yeah.
So yeah, I'm gonna make you. This is going on the record. You need to give me the links to that. So
okay, I'll send them your way.
So we're wanting to talk about patient engagement. So let's do home health and outpatient too. Just draw from those experiences. So if you were to kind of give a grade of how easy it is to communicate with patients, or even remind them of when you're coming to see them or they're coming to see you, but just kind of that dialogue once they leave the clinic, what was your experience in those two different settings with actual like patient communication once they left your building or you left their home?
Yeah, I think as a profession, we're generally speaking very well-meaning, want to help people. I don't think we do a very good job at communicating, even on some kind of basic levels. I think we maybe make too many assumptions about what people know or assume that they know, kind of things. And in the outpatient world, we traditionally give people a home exercise program, but everything's about the visit. So it seems like, at least back in the day, it was more geared like, if you can't figure out your HEP, then you'll come back and see me, because that's how we make our money, keep the doors open by having more visits. So there's not really a whole lot of communication, obviously, between visits, or they miss a visit here or there, no shows, and all that kind of craziness. In the home health world, it's a little bit better. Typically, I'm sure you've had many calls from caregivers will stay on top of things, and maybe a little too much. But there seems to be a little bit better communication. Plus, you're also dealing with other disciplines as well, nursing and OTs and the bath aide, everyone's favorite person. And trying to schedule when your visits are going to be and who's going to be there and all that kind of stuff.
Yeah, it seems I've been in home health and outpatient as well, and I definitely kind of echo a lot of what you're saying. Grant, I know there are like a lot of clinics will use different systems for like text reminders and stuff like that, which is great. But yeah, there's definitely a disconnect, and even in home health too. I think the avenues are there to communicate well with the patients, but what often seems to happen is that people just get so busy and schedules are always changing throughout the day, and you're juggling your patient schedules and then trying to work in around all the other disciplines, and it just seems like a lot typically gets missed. I know I don't want to make excuses, but it just seems like that's how things shake out. Even the best intentioned home health clinicians screw up and end up not communicating well, or telling a patient they're going to be there at a certain time or a certain time frame and don't make that. And yeah, it's a challenge for sure. Not to say it can't be done,
we're as a profession, we're not very progressive on adapting to change and trying new things out. We're more or less the type that waits for the change forced upon us before we adjust accordingly.
Yeah.
Some of that's kind of maybe built into the profession's history of being more of a passive participant in the care process and, being directed on what to do, or I don't know. That's just a thought.
Yeah. So in terms of, communication, that's definitely, we've kind of echoed the same experiences. What was home exercise programming like for you? Did you feel like you were able to do it well? And your patients actually did what you asked them to do?
No. At best, I was left to kind of scribble stuff down or use those really generic copied sheets of like the stick figured kinds of, people doing exercises and
a copied stick figure. That's awesome, man. So you're not even talking like the VHI, 6 exercise on a page, like a photocopied cartoon with stick figures.
Well, there were some of those as well. But yeah, there was also some definite hand-drawn and handwritten out kinds of stuff. And, you leave that place and you're like, who knows if that's going to just get buried underneath the 115 pieces of paperwork on their dining room table as they're, sorting out their bills, coming home from the hospital and all the chaos that they're trying to, remember to take their insulin and all these other things. And here's another sheet that's just going to go into the abyss.
Mm-hmm. Yeah. So what things have you done that you feel like were helpful? Like, let's say, you're mainly working with paper. That's all you got, whether, it's outpatient or home health. What are some things that you really try and implement or do just to increase your odds of the patient executing what you recommend?
The most important thing is, even more than the exercises itself, is the education on why. So I joke that every home health visit is, 15% treatment, 85% pep talk. And it's all about, a gentleman that I just saw this last week who is a self-admitted non-exerciser, hates exercise. Like, okay, well, here's what you want to do to be able to, be independent, leave home without your wife holding on to you. This is how you get there. So here are options on how to get there. You feel free to choose, but this is why it's important. And that's why we're doing these things to get you there. They're not just, short arc quads or ankle pumps.
Right.
Like this is functionally why you're doing this to get there. And so if you can get that point across, either written down or through the caregiver, then your odds go up significantly. Better them doing 2 or 3 exercises they're actually going to do than, this printed out 12 exercises that, they're not going to do any of them. So.
Yeah. And then you throw into the equation the other disciplines. And I mean, man, it's just crazy. I've seen, especially if I do like a reassessment visit and I'm just kind of going in being, I haven't been there in a month, like, okay, like what's been going on? What's the home exercise program? And sometimes I'll come in and there's 3 sheets for PT and 3 sheets for OT, 12 exercises for each one. And then a speech is in. I'm just like, let's think about this. There's no way that this person, is going to do all these things. I've literally have not met one person that has done the, standard 10 to 12 exercise routine for all the disciplines that have been in. It's really kind of mind blowing to see that. So I feel like number like connecting the why and then how many we prescribe is another big factor that I feel like a lot of people aren't necessarily cognizant of or aware of.
Yeah. And if you can keep it functional, like literally something part of their daily routine, I got them to agree to every commercial break to do 2 sit to stands from his chair.
Yeah.
Which take him like 10 seconds every 20 minutes. And I'm like, do you think you could do that? That's just standing up, sitting down, standing up, sitting down, maybe mix it in with getting a drink of water or going to the bathroom, it's like just part of your day. Yeah. Then your chances of it actually happening are probably, a little bit higher than if you give them a bunch of exercises that they have to do with all kinds of props or bands or, as well-meaning as those things can be, they can fall by the wayside pretty quick.
Yeah. I need to brush up on my habit research, but I do remember just reading about pairing a routine with something that's already like an ingrained habit or other routine, whether it's, brushing your teeth, taking meds, eating, just things that, we all do on a day-to-day basis. So we don't have to use a lot of mental energy to think about. And that was really powerful just to couple it with those types of things. So like, before you eat, just do, 5 to 10, sit to stands or, whatever exercise. But yeah, I just feel like being thoughtful of those different things, all the different factors that go into actually building a habit or them actually executing the desired behavior. Even thinking about that goes way beyond just handing someone the sheet that says, 3 sets of 10 per day. And just, crossing your fingers that they'll actually do it.
Yeah. And sometimes I've been lucky that I've got the patient themselves or maybe the caregiver is a little bit more tech savvy and it doesn't take a whole lot of tech savvy, but set a reminder in your phone. So every day at noon, it'll pop up that little reminder that says, hey, do your, walk around the house twice before you eat or, stuff like that. Try to, like you said, kind of make it part of your day and then have built-in reminders around those things if at all possible.
Right. Yeah. So let's use that as kind of a segue to, just some of the technology that we have now to help improve patient engagement, help, make the home exercise program a more engaging process. And, you work with In-Hand Health, but I want to use In-Hand Health as a pretty awesome example of just leveraging some of this new technology that a lot of our patients and caregivers are using. And if they aren't using it now, it's only a matter of time before, almost everyone, has some type of laptop, smartphone, tablet. But let's just talk about some of the features, that In-Hand Health has and just how they, address a lot of the problems that we face. And I want to frame this conversation kind of in the context of like this stuff helps people get better. It helps us stop wasting time and helps our patients improve, and makes the whole experience of getting physical therapy, whether it's in the home or not, just a much more pleasant, encounter. So, so what are some things, especially given your background, what are some things with the software that you just think are that you wish you would have had when you were, full time out in the clinic?
One of the greatest parts, I've been really fortunate to work with them on a consulting end, but also on a creative end, content creation and some of the resources and things have. You probably have in the past at some point in time worked with a patient on an exercise, and they're like, this is a little complicated. And you think, oh, if I write this out on the paper, it doesn't really fully explain what I want them to do. Oh, here, let me use your iPad or, your phone, and I will take a video of you doing the exercise on your phone so you can watch it later, or so the caregiver can watch it later. That's a fairly newer kind of thing to be able to do compared to when I first started. It doesn't feel like it was that long ago, but 9 years ago, that certainly wasn't happening on my flip phone. But then again, it kind of moves into, there are some therapists who would do those things and put them on their YouTube page and try and direct their clients to look at those videos. You start getting in some kind of weird gray areas about HIPAA, and then, they're not very well personalized.
Yeah.
If you're just sending everybody to, whereas there might be specific cue points that you do with patients. And so one of the things that I really like about In-Hand Health is that it's actually like a telehealth solution. It's not just some kind of passive thing. It's a way to, like you said, get better outcomes. You can actually, provide help and services without having to make that patient visit itself. You can custom create literally any exercise you want. Any video that you have on your phone, you can just upload it into the exercise library and name it and make it private just for that patient. So you can't even use that exercise for other patients, especially if it's something maybe detailed. Let's say it's a way for the caregiver to assist them, then you can take the video with like a pivot transfer, or, even nursing could use it for like a wound changing. And the cool thing about it is that you can just watch that video over and over again, and it's always on your phone with any other resources that you want them to have, like descriptions on like their personal condition. You can provide little helpful things that they can download and print off if they want, like food diets or voiding logs for people with incontinence issues. So you can print off a voiding and use that, or it adds this kind of HIPAA compliant library. But then there's also the communications part as well. So you're seeing the caregiver on when the appointment's going to be, or, like, hey, my dad's in the hospital. You're trying to get medical information across via text. The platform allows you to send not just text, but audio, images, and video as well. So I think about how many times I've been seeing patients. I'm sure you've gotten this call many times of just terror that, like, there's something terribly wrong with my wound. It's infected, and I'm about to die.
Yeah.
Like, if you can't get here in 30 minutes, I'm going to the hospital.
Right.
And 99 out of 100 times, it's totally normal. But you call all your patients, rearrange your schedule, drive out there. Yep. They just cut open your knee, cut the ends of the bones off, hammered metal pieces in there, sewed you back together. And it is red and warm, amazingly, after that. But that is actually what your body should do. It's part of the normal process, but you can't really convey that over the phone because they're panicked and freaking out, and because you don't actually see it. So inevitably there are those times where you can't get to them and you say, okay, just go to the ER. And then they go and look, they're kind of pissed off that you didn't tell them that it wasn't anything. So, so there's so many times where I thought, oh man, if I could have this, where they could literally just take a video of it and like, see, this is what the drainage is looking like. This is, and be able to say, like send them even back a video of me saying, yes, it's normal, explain it all, and they can watch that video again and again. So if they have questions later, what did he say again? Yeah. Oh, whereas, like the buzzword in the tech industry, they call it asynchronous telehealth. So whereas the difference between synchronous telehealth is you both have to be on Skype at the same time, or whatever video platform you're using. Okay. You're still making an appointment on, both people have to be on at the same time. Software has to be working. Whereas the asynchronous model is you can load your information whenever it's the most convenient for you as a provider. They can access it whenever is most convenient for them and continue to access it, because how many times have you had an appointment with your doc and left and said, oh gosh, what did they say again? Like, I can space it out. I didn't catch it all. The store and forward method of the asynchronous allows you to watch it again and again. I mean, just think of how cool that would be in more remote places where you've got, patients that are kind of hard to get to, but really should be seen more, but you really can't, or for whatever reason, they can't because of health reasons. You can still have that connection and keep up to date and have good communication, especially as we move towards more outcome-based payments. Right. Visits become less important. It's not as, you're not getting the push from your clinic or the agency to get X number of visits out of them. You're just trying to get them better.
Right.
So if this can get them better and less visits, it saves the company money on labor costs, you on driving in your own time, plus the patient gets better. So you get paid well with less visits. It's kind of like a double win.
Yeah, the video recording, man, I just think about all the different applications, and I think one that would be really helpful, especially in home health, is even using that to record the physician or the PA, kind of giving their recap, of the face-to-face visit, or just something along those lines, just because that's a huge communication gap between PT and the physicians, and just thinking even something like this could even help bridge that gap as well.
And one of the things they're rolling out now, speaking of in-hand health, is the ability to have multiple person thread in the messaging. So you would be able to have the ability to the nurse case manager, maybe as well as the OT, as well as the PT, and even if they wanted to, maybe the MD or the PA. Oh, look at all those letters I just rolled out. Wow, alphabet. You could have them all in on the thread. So if you did get to the patient and you're like, wow, that knee does look terrible. Let me take the video right now and drop that in that thread that goes straight to your MD. Because if I call in to this hospital care system, the only thing I can do is leave a message for the nurse, who won't get that until tonight. So I won't hear back until tomorrow morning.
Right.
So if you have, in the case of someone with a new total knee, you have those ortho surgeons who really want to know right away, you can say, here's what it looks like. And have even better communications that are, again, HIPAA compliant.
Yeah, it's pretty cool because, this technology, a lot of it, has been somewhat around, but it's been very fragmented. There hasn't been something all in one kind of bundle, with one name, with one, just piece of software. It's kind of like we had our HIPAA compliant text messaging was a separate service. Then you have your home exercise programming, which was another service. And then, scheduled reminders for, visits was another thing. And now it's like, all this stuff can be in-house. So the videos, a communication standpoint is huge. Something that intrigues me is the patient's ability to see their real-time progress. And some patients are very engaged in that I have. A lot of them aren't. It's more their caregiver or the caregiver that's out of town. The daughter that is concerned about her father who may be in an assisted living facility. So tell us more about the kind of how, the ability to actually share objective data with interested parties to show progress or how someone's doing.
Yeah. So with the software, I should explain even more. It's a patient app. So the patient accesses it via app. So any mobile device will work.
Okay.
And so they pull up the app, which they can set notifications for, to remind you every day at noon to do your video exercises and walk you through the exercises, not only visually, but tell you all the setup and what you should do. But after those exercises are complete, you can rate your pain level and what you feel is like your progress to date. And so they roll that up in like a care index number to kind of measure progress. And so that way, when you're the therapist, you can there's a therapist app, so you can have it on your phone with you at all times, or they have the web app version, and you just go onto your laptop or PC, and it'll pull up your dashboard of patients, and it will show your patients by how they're doing. So if they're having a lot more pain lately with their program, you'll be alerted right away to see who's doing well and who's not. And so maybe that can prompt you, if they haven't contacted you, like, hey, what's going on? Like you've been noting pain is there a problem with one of the particular exercises? Can we adjust things? And so there's the opportunity again for caregivers to be in the loop on all that stuff, whether it's other medical disciplines or, like the daughter out of town or the daughter who does all the caregiving work, but she's at work when you go to visit the home, and you're trying to leave information for her to follow up working with dad, who doesn't have very good memory. It's just another opportunity to have good communication.
The implications of that would be pretty awesome. And it would save, I shouldn't say headache, but man, just all the calls going back and forth with the patient and the caregiver and physician and all that stuff that could be in place.
And think about like it's covering your butt. So, you've got documentation that these communications happen. It's just another way to, prove your value as a therapist, whether you're talking about insurance companies or you're talking to doctors about how their patients aren't going to drop through the cracks or all those different scenarios.
So let's say,
and it's just the future. I mean, like,
that's
this,
a good
like
point.
you said, like it's just inevitable that this is the future. Went on a double date, my wife and a couple. Yeah, I know. It's like the first time in 6 years that I've been able to get out of the house without the twins. But, and she said that she has to go once a year to her doctor's appointment to get her allergy meds renewed. Like she has to burn that copay for that routine visit. Well, I mean, it's just a matter of time before those random routine visits where they don't actually do anything physical are changed out. So you don't have to make an appointment that you could potentially forget. or miss because you're sick or they're sick and then have to reschedule, or, miss during the day because crap, I've got something for my kids at school that came up. Mm-hmm. You can do the video asynchronous model and get all that information conveyed that you normally would, but you save an office visit. So again, it saves potentially, hospital systems a ton of money because they don't have to worry about no-shows and cancellations because they're going to get that visit
right
anyway. And they're actually much more likely to get that visit because it'll happen via telehealth. So we just have to work out the details legally on what payment looks like and all that, but it's just a matter of time. I mean, it's already happening in some other disciplines.
So when like a patient leaves, your clinic or you discharge them from home health, are there options for the patient to continue to have access to all that information that you gave them throughout the course of care?
Yeah, absolutely. You can just keep them on so they can access that. Depending on state, this is where it can be kind of interesting, but there is an option built into the in-hand health software where you can continue to monetize that, whether it's like a continuing care plan that you offer through your clinic where you consult them on wellness, health and wellness issues. Maybe they're like a runner and they just, you're a running expert and they want to stay connected with you during the running season in case things come up or little things here or there. Maybe they, just want to know about different types of running shoes. There's a resource in the resource library. You can push them and it'll go straight to their phone as a notification of here are my top recommended, running shoes via Runner's World or whoever, or a 10K running program. And, so if you have those kind of services via your clinic, you can continue that with the software via the app. So that could look a bunch of different ways. If, they basically keep you on retainer, like a health and wellness consultant, in a different role. Maybe you also do some personal training as well. It can take care of that, and the app will actually process that transaction. So the patient wouldn't have to go to your clinic and pay. They can process it right there through the software as well. So that's just an added thing, which will be again bigger down the road when you talk about like health and wellness and employer-based health programs, wellness programs, that kind of thing.
What does Medicare say about that?
Oh, you know what? I haven't in the outpatient world. That would be like a no-no, obviously, in the home health world.
Yeah.
Okay. I don't know in the outpatient world whether you can do those kind of continuing care services.
Yeah. It's almost question. Like a Jared Carter question. Mr. Medicare cash pay. I think he wrote like a whole book on that stuff. Well, that's cool. I mean, it is impressive. We're talking about in-hand health, and I don't think there's any other company that's doing something like this comprehensively. But I mean, these are all just features, just leveraging the current technology. It's just a matter of time before this stuff is standard. And so it's cool to see that y'all are definitely ahead of the game, and rolling this stuff out and leveraging technology. So I guess I want to kind of wrap things up just with one question, and because realistically, everyone, including myself, we live in the current state of physical therapy or just rehabilitation, where a lot of this technology, if it is available to us, it's super clunky and not user friendly, or we just don't have it. We're still on paper. We may be, sending some links to YouTube videos or, recording ourselves on our patient's smartphone and they can watch later. But we're still operating, in this world where a lot of the technology that in-hand health provides isn't available to us. So if you think that's your audience that you're about to answer this question to, what are the, I guess if you were to go back to like full-time, home health work, think about all the lessons that you've had in interacting with in-hand health and learning about, how they are trying to engage patients, how they're trying to, create habits to change behaviors, and just all the things that they think about, with this app. How would that change how you would practice in home health?
Ooh, that's a fantastic question.
That was a long one. I apologize. But.
Yeah, that was. Yeah, thanks for the ramble on. What in the end in home health, the biggest thing that I see personally is being able to have potentially that communication either with the patient or their primary caregiver. Being able to have that immediate connection without giving them your phone number, because we've all had those where they call you a lot. But to be able to give resources and know that they're not going to lose them because they're on the phone with notifications that are going to pop up and remind them. It's not going to get buried on the back burner. You're going to have perfect clarity of what you've instructed and what you want from them that they can, watch again and again. It just kind of reinforces that you're going to have a better outcome. Everybody's on the same page, help to eliminate any confusion. From that angle of things is really in the home health world, the biggest thing for me.
Yeah.
Because there's just so many times where that communication doesn't come across, or you tell your patient, but they've got memory issues and it gets relayed to their caregiver wrong. And then there's this huge issue and you're trying to call the doctor's office and you can't get information from there. And, to streamline it, keep it all together, to be able to have nursing in the loop on the same, messaging thread if you wanted. So everyone's on the same page. It just helps to eliminate those potential catastrophic errors or the really bad situations that could have easily been avoided.
Well, Sean, thank you, sir. Appreciate you hopping on and having a early afternoon drink with me. I had a beer. I won't mention what Sean was sipping on.
Iced tea, baby.
All right, folks, inhandhealth.com. Check out the software. It's pretty awesome. But most importantly, think about how you can implement, given what you have right now, to help better engage your patients. I know for me, I'm getting a little sloppy with my stick figures, Sean. I need to, tidy them up, clean them up, really.
Yeah.
They're very disproportionate stick figures. I need to step my game up. So, or just get in-hand health, whichever. Yeah,
I was going to say, hopefully, whatever people end up choosing, hopefully those days are behind us. I mean, I'm certainly looking forward to kind of the new option.
Yeah. Awesome. So check out that website. I'll put some links in the show notes to In-Hand Health, but then also Sean Hagey at Twitter. So it's at Sean Hagey, Hagey. You can definitely ask him a question on there, or ask him if he could do some more feats of strength videos. I think he may be in a position in life to break one out here pretty soon. You could even have your kids help you. That'd be a fun one to watch.
Oh, okay. I'll think about it.
Get them involved. So, Sean, I appreciate your time, and the listeners. Yeah, check out the links in the show notes, and I'll talk with y'all soon. Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.